Great. So I should start by acknowledging that this is shared work, teamwork with Patrick Prague, Cecilia Potenta, and Joan Maria, who at one time were all either students or postdocs at Oxford and have now moved on. So the background of this question of the effect of children's education on their parents' longevity comes from a large research line in spillover effects of education. So it's very well known that your own education is positively correlated with health, and that at least part of that seems to be a causal effect. Education provides a very flexible set of resources to individuals that allows them to keep their health in good shape across their life course, but also just means that they are exposed to fewer health hazards across life. And this broad set of resources that is associated with higher education, they not only affect your own health, but we know from studies that they are at least correlated with these resources that others around you have. So for instance, your siblings or your spouse, if they have these positive resources through education, that might, the positive effects on health might spill over to you. In the parent-children relationship, we of course know from a very big body of literature that parents' education is positively associated with children's health. And we know this in particular for maternal health on the effects of children's mortality. And so there's a big literature describing these spillovers, but what we do not know is what about the spillover from adult children to their adult parents. So the educational level of the next generation, so to say, does that in itself have a positive effect on the health and longevity of their parents? And that's a relatively recent question, and we try in these set of two papers actually to make a contribution to this literature. Now, we do look at individual effects. So we look at the children and the effect of their education on their parents. But of course, one way to frame this research question is that this is also about intergenerational solidarity or generation trade-offs when we're thinking about investing money into education for children or investing that same money into care for older generations. It might be relevant to look at these kind of spillover effects because maybe older generations also benefit from these investments in younger generations. And again, here we're looking at a very direct way in which that would happen. We can imagine that investing in younger generations will inevitably have positive effects for older generations by the larger socioeconomic benefits that a higher generation will bring. But here we're looking at that very specific link at the micro level. So that's kind of the background, the literature that we're trying to contribute to. And then more specifically, we got interested in this question by the Friedman and Mayer paper in Demography in 2014, that for the US suggests that if you compare older individuals where all their children have college education or all their children have less than high school, that there is a 2-year difference in life expectancy between these groups. And now 2 years life expectancy difference is a huge effect. They attributed that to the difference in educational level of the children, controlling for the education, SES income, etc., of the parents. And so we were intrigued by this result and wondered, can we find evidence of this? Is this true in other countries as well? So just a little bit about the possible pathways behind these associations. I won't be able to look into them. Our studies are simply concerned with estimating a causal effect of this children's spillover effect on parents. But just to give you an idea of what might be going on, these are some of the most commonly discussed pathways in the literature. So one is that the effect might go through health behavior. We know that higher education is associated with less smoking initiation or cessation, better health-related behaviors in terms of seeking medical advice, adhering to medical advice, exercise, diet, etc. And it may be the case that higher educated children have better health behavior, and this affects their parents' behavior. They may be better able to convince their parents to stop smoking or to support them in that, to improve their diets, etc. Obviously, a second one might be simply material factors, higher income through that higher education, better able to support financially parents. Some people have also argued that through their better jobs, these children are better able to help their children, and maybe in particular because higher educated children are more likely to work in healthcare, which on the one hand might give them more health information that they can help their parents with. I think particularly an interesting link is that they are more familiar with the health system and are better able to help their parents navigate our rather complex health systems. So to get the care that you need when you need it in the right way is quite complex. And you need to talk to doctors and nurses and understand the system. And these children might simply be better able to assist their parents in that, and by doing so help their health and longevity. And then finally, another mechanism is that as we saw, lower educated children are more likely, for instance, to divorce, are more likely to become unemployed, and a whole series of kind of more negative life events are more likely to happen to them. So that might induce more stress in parents with lower educated children, which is detrimental for their health. That leads us to the expectation of a positive effect. In estimating that effect, we of course have to take into account a lot of unobserved heterogeneity. This could be through the environment, it could be through genes, but really the problem is when we look at this diagram here, we're interested in children's education on parental health, but we know parents' SES is related to both, and although we can control for that, what we really want is to block out this correlation between parents' SES and children's education, and we want to identify some random variation or exogenous differences in children's education that allows us to estimate a causal effect on parents' health. And that's what we try to do in these two sets of papers. As I said before, this is a growing field. The number of studies have increased over the last few years. So it used to be an under-researched topic, but it's a quite growing topic now. These studies that have come up in the last few years don't cover a lot of countries, so it's important, I think, to add more country studies to this, which is one of the things we're doing here by looking at England and Wales. But most importantly, most of these studies are associational. So they try to control for relevant confounders. And then there are a few different strategies to come at a causal estimate, which is either using some form of sibling or cousin fixed effects. And then the majority, but as you can see here, there are not that many studies, use educational reforms to try to get a causal estimate of the children's effect on parents. I won't walk you through all these causal studies. I'll just show the last one because it has an intriguing finding. But one of the things that you will see here is that because we use these educational reforms, researchers have really been just looking for, I think, places where such reforms happen. And of course, these are very different kind of situations. The 1970s schooling reform in Tanzania, or the one in Vietnam in 1991, can we really transport those findings to the UK, for instance? So there are very few studies in a kind of similar setting to the UK. One that maybe comes closest is the Swedish study, and what we find particularly interesting there is that it found a positive effect of children's education on parents' well-being, longevity, but in particular for low-educated fathers who have higher educated daughters. And of course, we know these gender roles in families vary so much, and women are often the kin keeper, but also the first kind of person to provide care. So we're interested to see if we can replicate the same finding in the UK. Is there a difference by sons and daughters? Is it the case that daughters are more important in this sense? And does this differ between fathers and mothers and the resources that the parents have themselves? So first of all, I should say that we replicated these associational studies, and so we, with a longitudinal cohort study, we find that both mothers and fathers' mortality is related to children's education. So educational attainment lowers mothers and fathers' mortality in a simple associational study, controlling for the usual suspects. But of course, we know here that we don't have a clean causal effect, but it sits well within the estimates of these other studies. We can at least replicate the associational finding. We then move on to use these two reforms that you see in the pink bars here. And these reforms here, I've plotted them to the birth cohort. There were two reforms. One affected the 1947 birth cohort. It happened in 1947, and it meant that instead of 14 years, you had to stay in school for until you were 15. And so it affects the cohort born in 1933. And then there was another reform that happened in 1972, an additional year that pupils had to stay in school from 15 to 16. And what you can see there is that happened to the birth cohort of 1958. So what this means is that children born August 31st, 1958, because the cutoff year for when you go to school is the 1st of September. So the pupils born on the 31st of August, they could leave school when they were 15. Those born on the 1st of September, they had to stay in school a year longer. And now the core argument here is that those children, those born on the 31st of September, of August, and those on the 1st of September, don't really differ in any meaningful way. And their parents don't really differ. It's the same group, and what is really random is whether they are born on that one day or the other day. And that random luck determines whether they had to stay in school for a year longer. And so you can see that around that cutoff, and if we widen that window to a month, those born in August are not really different than those born in September. That the variation in education that we see there has this random element. The same, of course, is true for the 47 reform, and we use this random variation to estimate the causal effect. To do so, we need a large sample that is born just before or after these cutoffs. And in the first study that we do, we use linked census data. We have the 1971 census, and you see here the original census card in green, and it asked of all the individuals in that year when their children were born. Now, unfortunately, it only asked the month and the year. It didn't ask whether it was a boy or a girl, and these children weren't followed up. So we don't know what level of education they eventually had. But what we do know is that these children were either exposed to the reform or were not exposed to the reform. And the expectation then is simply that if this reform had a positive effect on education, and education of these children has an effect on the longevity of the parents, we should see a rather sudden change from that point onwards. So we follow up these parents who were interviewed in 1971 until they die, or some of them are still alive, but they've been followed up in the census since then. A 1% sample of the complete census, giving us about 55,000 mothers and 50,000 fathers. Married fathers, I should say, because it wasn't asked of men, it was only asked of women whether they had children. And so we follow them up, and then we see whether there is a jump. And that's what the regression discontinuity design does. So what we see here is the proportion of mothers on the left and fathers on the right who have deceased by the birth quarter of the children. And of course, this is a decreasing line because these parents will be younger if their children were born later. And so but what we're looking for is around this policy cutoff, do we see this jump? And especially for fathers on the right, we see that there is a jump in the proportion of deceased fathers around the cutoff. And you see that here and here in these figures, suggesting that there is a positive change happening suddenly there. And the only really change there is that the policy kicked in, that children had to stay in school for that 1 year longer. So when we formally estimate effects here, then we get these results. In blue are the point estimates and the confidence interval, and in red the ones that are significantly different from zero. And actually what we find for a whole series of outcomes, death before age 65, we looked at preventable deaths. So by cause of death, we looked at causes that are more preventable than others to get at this idea of it should be stronger for preventable deaths because your children's behavior should affect them, but not the unpreventable ones that are just really bad luck. Lung cancer, because we thought maybe higher educated children have this effect on the smoking of children, of parents, etc. But what we really see is that there aren't any significant effects, just the two red ones that we are not very confident to give too strong interpretation because of the lack of significant effects across this series of outcomes. The overall effect for overall mortality death is in the right direction, a 1.4 and 2.3% reduction in mortality for men and women respectively, but the confidence interval is just a bit too wide. So on the basis of these results, we can't really conclude that there is a significant effect of children's education. But bear in mind that, of course, we have what is called an intention to treat effect, and that we can't differentiate between sons and daughters because we only had information about the birth date of the children, and also we can't estimate or say anything about whether the children who were exposed to the reform really stayed in school longer and whether that resulted in extra education. So we find the association, but we don't find the evidence for a causal effect, and there are some reasons for that. And one might be actually that this particular change from having to be in school for 10 years and now for 11 years, maybe that's not the educational differences, that maybe is not the location in the educational distribution that is relevant. So we did a second study using the English longitudinal study of aging, for a number of reasons. First of all, we think replication is useful by definition almost. But also in this one, we have information about the children's education and about whether they are a boy or a girl. So we can look at the sex-specific comparisons, but also we can look at both educational reforms. So the first study was just the second reform. Now we have the first reform as well. And instead of just being able to look at an intention to treat effect, we can look at the local average treatment effect. The ELSA is a biannual panel starting at age 50. We have about 18,000 individuals, and the respondents report whether their parents are still alive, and if they are not alive anymore, the age of their death. And we got a special license access to have precise birth date information to be able to determine the cutoff date of the reforms. When we first do a simple associational study, we again replicate the finding that school leaving age of the children is related to lower mortality, and this is true if we simply only correct for sex and race. But also if we control for father's education and occupation, etc. So again, this is what we would expect and find what other studies also do. But to what extent does this remain when we look at what can really be thought of as a causal effect? And to do so, we do a Cox regression on the survival, on the relative hazard ratio to deal with right censoring. So a lot of these parents have not deceased yet, but we know what their age was when we last observed them. And then we do a standard fuzzy regression discontinuity design, controlling for ethnicity, residence, and social class of the child, etc., and education of both parents. And this is then our main finding: left for mothers, right for fathers, sons and daughters for the two for the two reforms. And we do find clear evidence in most cases here for the causal effect that more education of the children is related to lower overall mortality. As you can see that for the sons in the first reform, there's a bit of overlap with the 0 of the confidence interval. But more importantly, I think there isn't a clear gender finding here. We don't find that sons clearly have a stronger effect than daughters, or the other way around. So we don't replicate that finding, and there isn't a clear gender difference. These estimates also overlap quite a bit, but I think it would be brave to conclude that there is a clear pattern here. So we conclude that children's education has a positive causal effect on parents' longevity, but there isn't a clear gender pattern. And what I haven't showed is the other analysis that we have done to see whether this varies by socioeconomic status, etc. And again, we don't find any evidence there. This is an effect that we found across the full sample, but it's not stronger for parents who have fewer resources themselves, or for the combination that was found in Sweden of low SES fathers and daughters. So then to conclude, across these two studies, we find some evidence that higher education in children contributes to parental longevity, even in a high-income country and setting with free healthcare, such as the UK. We also concluded that replication is actually quite difficult, and we don't have I find myself so satisfying explanation as to why we do find significant effects in one study and not in the other. There are differences in the data, in the methods, but exactly why that would explain the difference in finding is not clear. It does make us wonder about publication bias in the literature. We have published the null result, but it was very difficult to publish it. And it makes you wonder how many null results are on our computers unpublished. It also made us wonder about, is education really the relevant thing in the UK? Of course, the UK famously is a class-based society. Is it really education? I still strongly think it is. Many of my British colleagues wonder if that's true, but education is very strongly related to the occupation people later go on to have, and that occupation is often seen as the basis for class, but there is such a very strong link to education. And so I don't think that's a reason we don't find stronger effects. What I do think, however, is really important is thinking more closely about the actual meaning implementation of the reforms. And so there are many studies out there, including ours, where people use a reform to estimate a causal effect. But when we went looking for data about what did this reform actually mean on the ground and how much variation was there across different regions and for different pupils, were they just kept in a classroom for 1 year? Some schools will have made that a meaningful year. Other schools maybe didn't have the resources and just kept the kids in. And maybe only over time did that 1 extra year become a meaningful year where pupils actually learned something new, and as a result went on to more education. There is very little literature on the reform, and that variation in the reform would actually be worthwhile to know more about. And of course, if that implementation wasn't as strong, not as universal, then that may be a reason why we don't find stronger effects. But also in the end, of course, we want to be able to say something about the reform as well, not just use it as a way to identify a causal effect. And so as a general kind of note to myself, but also in general, I think we, in these kind of studies, rather than only being interested in estimating some causal effect, we should be much more careful about understanding what really the implementation of the reform looked like. And I'll leave it at that for now. Thank you very much.